is a little thicker. This is a medium. And this is the heaviest one. You can see how the difference in the thickness. So I'm going to use the light one for demonstration purposes. And you can do this. Pretend you have a band. All right? Bicep curl. I'm just going to step out again. I know we're running out on my time. So if you had a band, this is your stable position right here. This is actually not as stable as this. So if you're stable enough, you can stand like this with both feet on the band and lift and lower. And I'll pass these around for you to demonstrate when we're done. But pretending you have a band or hand weights, you want to squeeze the muscle and release. We did a little bit of this earlier, but now we're just simply concentrating on the bicep. Ready? So 8, 7, and 6. 5, 4, 3, 2, and 1. Release. So, bicep curl. Tricep, the back of the arm. You should concentrate on working opposing muscle groups. So if you work the front of the arm, don't forget the back of the arm, all right? Using a dumbbell, you can use a band too, but this is easier with a dumbbell. Put the band to the side. You want to brace yourself. Remember, this is a stable position. Brace yourself. One hand on the top of your thigh. Lift your elbow up. Take your arm back. Good. Out. Good. Now this is not shoulder. I see this a lot of it. You're not working your shoulders. Concentrating. You're simply moving the elbow and the arm back and forward. Back. And if I can have more time, and I can certainly demonstrate this afterwards, what you want to feel is a squeeze back here. You can't feel it yourself. Make a squeeze and release. Always want to make the muscle stronger, harder by pumping it up. All right, that's upper body. I could do more, but I'm here all day. My passion. I really enjoy working out with books. And so thank you very much. Please work out.
Thank you again, Dr. Debra Williams. Okay, so on from physical activity. How's everyone feeling? Pumped up? All right, let's move on to the rest of it. And we are now going to learn about nutrition from Alicia Higgins. And Alicia Higgins, MSW, is currently the Promise Zone Hunger Relief Director at RSVP/Philadelphia. She recruits senior volunteers in the West Philadelphia area to participate in cooking and gardening groups that emphasize healthy eating and the inclusion of fresh produce in preparing meals. In addition to providing various benefits for volunteers, these groups also feed homebound seniors who are unable to prepare their own meals. Prior to working at RSVP Philadelphia, she served as an AmeriCorps Vista member with the Coalition Against Hunger, working on increasing access to SNAP and other food resources to Philadelphia seniors. Ms. Higgins has a Bachelor's of Social Work degree from New York University and received her Master's of Social Work degree from the University of Pennsylvania with a concentration in community practice. She has worked with seniors in a number of capacities and hopes to continue her work with the Aging Network. So let's welcome Alicia Higgins.
Good morning, everyone. Well, I don't know about you, but I worked up a sweat, so thanks, Debra. I don't have to go work out today. It's great. Just kidding. So as Marie mentioned, my name is Alicia, and as she also mentioned, I work with seniors out in West Philadelphia to increase food access. So just a little bit more about me. I moved here around 3 years ago, and I moved moved here for school. So, throughout various like work and internship experiences, I always enjoyed working with seniors, but one thing I kind of found was the connection to food was always somehow in the picture. I found that a lot of the older folks that I work with either like weren't eating enough or weren't eating the right meals. So I saw that like this was a major issue, and I was like, well, I need to be part of the solution. So as Marie mentioned, in my current job, I help with food access by facilitating cooking and gardening groups for seniors in the West Philadelphia area, because research has shown that that area is a food desert, doesn't really have a supermarket where folks can buy fresh produce, fresh fruits and vegetables easily to feed themselves and their family. And in thinking about LGBT older folks specifically, who have notoriously been marginalized from traditional healthcare systems, so research has shown that folks aren't as willing to go to the doctor, aren't as willing to see specialists if they have specific chronic diseases. And you think about that, in addition to the higher incidences of diseases such as diabetes, cancer, folks living with an HIV or AIDS diagnosis, that's really kind of like a recipe for, just a lot of issues as folks grow older in the community. But as I was thinking, as I was kind of doing research for this presentation, I found that all of these diseases have some sort of link to nutrition. Diseases such as diabetes and hypertension can kind of stem directly from an improper diet, a diet that is lacking in fruits and vegetables. And in diseases such as cancer, or if someone is living with an HIV or AIDS diagnosis, having these nutrition-rich foods, I'm talking about your dark leafy greens, your fruits and vegetables. I saw someone grab a nice, healthy bowl of cantaloupes and honeydew, so that makes me really happy. But kind of supplying your diet with these foods can really help keep these diseases at bay as someone grows older and kind of just improve their lifespan. And additionally, for LGBT older folks, research has shown that poverty is a huge link in terms of accessing these healthy foods. So again, when I first moved to Philadelphia, I was like pretty young, I was in my early 20s, and when I kind of started seeing these patterns, I naively thought, oh, well, this is not an issue, like everyone's eating, but that clearly wasn't the case at all. So I'm not really a numbers person, but I saw these two data statistics when I was doing my research, and I thought that it was really interesting. So there aren't really a lot of studies in particular around LGBT older folks and nutrition, but the Williams Institute at UCLA did a study just on the lesbian, gay, and bisexual community at large, and they found that folks who identify as lesbian, gay, or bisexual just in the open community and who were living by themselves, they found that 20% of them were living under the federal poverty line, which, if folks don't know that number, it's around $11,000 a year. So 20% of folks were making $11,000 a year or less who are living by themselves. That's not a big number at all. And another study that was conducted by the Kaiser Family Foundation also showed that poverty among older adults in the general population has actually spiked from 9% to 15%. And to kind of localize that number, that's just around the United States, to localize that number in Philadelphia County, that number is closer to 20%. So again, that 1 in 5 number. So you think, folks who identify as lesbian, gay, or bisexual and are living by themselves, 1 in 5 of them are living under that $11,000 federal poverty line. And additionally, older folks in the general community, 1 in 5 of those folks are living in poverty. So you gotta think, there are some older folks who may identify as LGBT in that mix. So you gotta think, your community members are living in poverty, and many of them could be in Philadelphia County. So, there are federal programs out there that can help with food access. The most popular one is SNAP. And is everyone familiar with SNAP? New name for food stamps? Okay, great. So, SNAP, we can talk afterwards about your opinions on SNAP. But, SNAP is a great program through the federal government that can provide folks with the opportunity to buy fresh produce and vegetables at their supermarkets. But, of course, there's a huge caveat to that. The application is long and oftentimes very burdensome for people to fill out. And for folks who may identify as LGBT, there are lots of issues with gender identity and gender presentation, especially when you go to the county assistant's office and your gender identity and presentation may not match your photo ID. and that can cause a whole host of problems in accessing benefits. So I don't need to be a Debbie Downer about all of that because I did bring good information.